What's up, guys? I'm Larry with Yunique Medical, and I'm going to talk to you about hormone therapy this time. I do talk to a lot of females about this issue, but it's time to talk about you men. So obviously, men, our hormones decrease over time as well, and we're seeing that more and more, even in younger, people like myself. So 30s, 40s, and it's because of high insulin levels, all these different reasons, our lifestyles, our stress, our lack of sleep. So it just really lowers our testosterone. So we get symptoms. So what are symptoms for men? So a lot of guys are going to be, number one, tired. They're going to have these bellies that they don't really like and can't lose the weight. They're crushing it in the gym. They're trying the diet. Nothing's happening. Just lots of brain fog. A lot of times the muscle mass just isn't what it used to be. They can't gain, the mass. And then they can also have erectile dysfunction issues. So, maybe they're having problems in the bedroom, and that's legit. And, that can even happen in young guys. So that's not an uncommon thing. I see it all the time. So those are some symptoms that a man could be having, and it's important to optimize those hormones. Okay. So once again, we're not replacing them. We're optimizing them for peak performance. So for a male, we want to not be tired. We want to be able to crush our day. We want to be able to work hard, use our mind, that mental sharpness and acuity to get things done. Once again, if you watch any of my stuff, entrepreneurs is kind of my niche. But then there are a lot of other people that need hormone replacement as well, our optimization. So men, it's very important for us too. A lot of people talk about women and their hormones, but men, super important, especially if we want to have, the peak performance that we're used to having when we were younger, or heck, the peak performance that we need to continue. If you have children, you want to be able to play with them, hang out with them. You don't want to come home from work and fall asleep on the couch and not be able to do anything on weekends because you're just utterly exhausted and you could care less about anything. So that's why it's important to see somebody to optimize those hormones. And I'm going to lump in the side effects into this one video so I don't have to make a separate one. So side effects for men are very, very minimal, but they have to be managed appropriately. All right. So with men, sometimes we can have something called erythrocytosis, which means you make too many red blood cells. So that's a problem because you can get this thick blood. If you get thick blood, we worry about heart attacks, we worry about strokes. But if you're being managed by a provider who actually is checking labs on you regularly, you don't have to worry as much about it, because if we catch it early on, you donate some blood, problems resolved. Also, if you got to watch out for overdosing of testosterone. A lot of other providers out there just pounding guys with testosterone, ridiculous levels of testosterone. Not optimized, but super physiologic. Those guys can completely lose their hair, actually have more erectile dysfunction issues than before. And actually what happens is something called tachyphylaxis, which means you need more and more and more and more drug to get the same physical effect, that eventually it just stops working and you feel worse than you actually did before. So those are a lot of people that are hard work to turn around. So those would be the main side effects that I would say for a male. I don't see this roid rage concept. Some wives kind of worry about that, but no, we don't see that. And then in men, sometimes our estrogen levels can get a little too high, and some men get moody. They're crying watching puppies play on a movie. And that's not normal. And, there's some concepts out there where, some people believe that you shouldn't decrease the estrogen and some people believe that you should. I'm kind of in the middle. So I think a man should have some estrogen, but not a ton and not zero, but somewhere's in the middle. Men, we need estrogen too. We actually have receptors in our body that need them. So that would be the whole wrap up on optimization. So if you're a guy and you're interested in hormone optimization and you want to pick pellets as your method, I'm probably your guy. So hit us up, watch the other videos. Thank you for watching.